My name is Chris and I'm a speech and language therapist. Speech and language therapists are trained to work with adults and children in a variety of areas. These include understanding language, using language, social skills, speech, voice, fluency and swallowing, amongst others. Speech, language and communication skills are crucial to humans as they allow us to access the world around us. In this short video, I will be talking about the following key areas: speech in children, language in children, social skills for children, fluency for children, and then for adults, language, speech, voice, communication, and swallowing. For children with a language impairment, learning and interactions can be difficult. Speech and language therapists may work on following directions: increasing vocabulary, building sentences, understanding new information, and this would be determined by goals that are set by the speech and language therapist with the child's teacher or carer. Children with a speech impairment may have problems getting their message across or being understood. Speech can be split into two areas: articulation and phonology. Articulation refers to the making of sounds, while phonology refers to sound awareness and how sounds change. Based on an assessment, a speech and language therapist may recommend that you work on particular sounds or particular sound processes if it's phonology. Social skills, or using our language and communication skills, are key in forming relationships and maintaining relationships. Speech and language therapists can work on social skills on a one-to-one basis or in a group. Social skills that may be worked on could include taking turns, winning and losing, or managing a conversation. These will be based on an assessment and a detailed discussion with the teacher, carer, or parents. Fluency refers to stammering or stuttering. Stammering can occur for a wide variety of reasons, including genetic, psychological, and social factors. It is important that stammering is noticed as early as possible, so if you see signs of disfluency or stammering, you should notify a speech therapist. Therapy is often done through or with parents and involves environmental modification. Adults may present with a language difficulty which they've lived with for their whole life, or which they've acquired following an incident such as a stroke, or as part of a progressive illness. A loss of language really affects a person's life, their quality of life, and their communication with other people. A speech and language therapist may work directly with that person or with their communication partners in helping that person to better understand information and to use language as well. In adults, a speech impairment may be experienced as part of a progressive illness, following a stroke or traumatic brain injury. A speech and language therapist would work directly with the person who is experiencing the speech difficulty or with their families. Speech is central to having your message understood and also to your quality of life. Adults may experience difficulty swallowing following a stroke or as part of a progressive illness. Safe swallowing is key socially for our health and well-being, but it's also important that we know we can manage food and liquids. A speech and language therapist, based on an assessment, may recommend changes to your diet or liquids in order to ensure that your swallow is safe and there is no food or fluids going into your lungs or airway. Adults may experience voice problems either suddenly or over a longer period of time. In an assessment, a speech and language therapist will discuss any problems, issues, or changes that you've noticed in your voice. Voice impairments can occur for a variety of reasons, including environmental, psychological, social, medical, or occupational factors. An ear, nose, and throat specialist will likely be used to also look at images of your vocal cords and give an objective picture. If you or a loved one are experiencing any of the difficulties outlined in this video, you can contact a speech and language therapist directly. In most countries, you don't need to contact your doctor or to use a GP referral to get through to a speech and language therapist. To find out more information, visit catsireland.com, like us on Facebook, or call the number on the screen.